Our next story revolves around the latest developments regarding a subvariant of COVID-19, the JN1. Kerala Health Minister Veena George on Sunday assured residents that the government is closely monitoring the situation. Here's more. Kerala Health Minister Veena George sought to allay concerns over the COVID-19 subvariant JN1, emphasizing that there's no need for panic. The subvariant was first detected in September 2023 in the United States and has now made its presence known in Kerala. Minister George stressed that the state's robust health system allowed for early detection through genomic sequencing. Simultaneously, the Union Minister of Health has initiated preparedness measures in response to the identification of the JN1 subvariant in Kerala. Dr. Rajiv Bhal, Director General of the Indian Council of Medical Research, confirmed this during a press briefing in New Delhi. In an ongoing routine surveillance conducted by the Indian SARS-CoV-2 Genomics Consortium, a case of the JN1 subvariant was identified. As a precautionary measure, a mock drill is underway in health facilities across state to evaluate public health and hospital readiness. This exercise, overseen by district collectors, is scheduled for completion by December 18, 2023. While most cases in Kerala are reported as clinically mild, health authorities have emphasized the need for continuous vigilance and readiness to address the evolving situation associated with COVID-19 variants. The Indian SARS-CoV-2 Genomics Consortium is actively engaged in monitoring the genetic aspects of COVID-19 in the country. In a related development, China has detected 7 infections of the COVID subvariant JN1. Authorities claim the prevalence level is currently very low but did not rule out the possibility of it becoming the dominant strain in China due to factors including imported cases. Here's what the World Health Organization had to say about the current surge in respiratory diseases, COVID-19 and subvariant JN1.
We're seeing a surge or an increase in respiratory infections for a number of reasons. It's not just COVID-19 that is circulating. We have influenza, we have other viruses, we have other bacteria. And in some parts of the world, we're entering the winter months, but in all parts of the world, people are starting to gather for the holiday season. And as people gather, they spend more time indoors, especially if there's poor ventilation. These pathogens that spread efficiently between people and through the air will take advantage. COVID-19 is one of the diseases that is currently on the rise, and this is again due to a number of factors. This virus, SARS-CoV-2, is evolving, it's changing, and it's circulating in all countries. And we know this through reports from countries, either from traditional-based surveillance systems, but also through wastewater systems in some countries. We have these XBB sublineages, and they represent around 68% or so of the sequences that are shared globally. The other grouping are these BA.2.86 sublineages. You've heard about these, but probably most notably JN.1, which causes the full spectrum of disease, everything from asymptomatic infection all the way to severe disease and death, similar to what we've seen with other Omicron sublineages. What is really important is that we are able to track this, and so we are asking our member states to continue with strong surveillance, good sequencing, and sharing of those sequences in a timely manner so we can assess the circulation around the world and take some steps to potentially modify what we are advising to the world. The advice that we give to all people around the world is similar to what we have in the past. Protect yourself from infection using a number of different tools, but also make sure that if you get infected, that you seek clinical care and you get vaccinated when it's your turn to prevent severe disease and death. All approved COVID-19 vaccines continue to provide protection against severe disease and death, and this includes against all of the circulating variants, including JN.1.
Shubhashish Govekar and Sangeeta Oli for GOA365.